Do you know how dangerous a vitamin B12 deficiency can be? And many people are walking around with this deficiency and they don't even realize it until weird symptoms begin popping up. This essential nutrient plays an enormous role in many aspects of your health, from creating DNA and red blood cells to supporting bone health and stabilizing your mood by stimulating serotonin, the feel-good hormone. It also elevates your energy level. But we can't forget how critical it is for nourishing the brain and the peripheral nervous system. So in today's video, we're going to talk about the havoc a B12 deficiency can wreak with your body and the extensive damage it can cause to your brain and your nerves. We'll also explore who's most at risk for developing a B12 deficiency, and I'll go over some of the causes. I guarantee you there'll be a few in there that you'll never heard of, and it will take you by surprise. Now, make sure you stick with me until the end, because I'll also reveal which supplements you should never take to elevate your B12 levels. You don't want to miss this. Coming up. Hey gang, Dr. Valerie Montero here. If you're finally ready to conquer your peripheral neuropathy, reclaim your life, and start living again, then make sure you subscribe to our channel and don't forget to click on the bell so that you get notified as soon as we publish new content. Now, let's take a deep dive into this video. Vitamin B12 deficiencies are considered actually quite rare in the US, but I'm telling you, this is completely false, and I'll explain why. First of all, it's important to realize that B12 is what's called an essential vitamin. This means that our bodies can't make it. We have to consume it in our diet by eating things like red meat, poultry, fish, eggs, and dairy products. Since most of the population typically eats these things, well, then it's just automatically assumed by the standard medical community that a B12 deficiency will rarely occur. But believe it or not, this deficiency is fairly common. So how can this be? Well, you can't just look at what people are eating. You also have to take into account other things that they do in their lives that very quickly deplete their bodies of these B vitamins. And I'll go over these things in just a minute. But before I do, there's something else that I want you to be aware of. When a doctor runs a vitamin B12 lab test called a serum B12 test, it usually comes back normal. See? No deficiency. Well, not exactly. What the average doctor doesn't realize is that this test, which measures molecules known as cobalamin, isn't sensitive or specific. This means the test does not accurately pick up on how many cobalamin molecules there are in the bloodstream. In fact, numerous research studies have pointed out how flawed this test is, and it produces the largest amount of incorrect findings. The reason doctors are still using this test to date is because they're unaware that there are better options that more accurately identify the cobalamin levels in the blood and the body. Now, the scientific literature has known that the most appropriate and most accurate way to determine a B12 deficiency is by running what's called an MMA test, which stands for methylmalonic acid, in conjunction with also running a homocysteine test along with the serum B12 test. This is the only way to accurately determine if this vitamin is deficient. So why aren't doctors doing this? Well, most physicians aren't taught to run these tests together, and frankly, they don't know how to interpret the findings of this test. A B12 deficiency has severe consequences to the body. First, it can cause severe peripheral neuropathy. Lack of this vitamin can cause a breakdown in the myelin sheath of the nerve. Remember, this is the insulating coating around the nerves, including your brain and your spinal cord. And its function is to transmit electrical signals very quickly from the brain to the nerves and back again. Damaged myelin causes these impulses to slow down, resulting in peripheral neuropathy symptoms. Now, here's another thing. I bet you didn't know B12 is necessary for nerve growth and regeneration. Without this critical nutrient, the damaged nerve doesn't get repaired. B12 is also extremely important for brain function. A lack of it can result in cognitive decline and brain atrophy, or shrinkage of the brain. This leads to significant memory loss and dementia. But it doesn't stop here. Vitamin B12 deficiencies can also lead to anemia, fatigue, muscle weakness, intestinal problems, mood disturbances, and depression. Now, let's talk about who's most at risk for a B12 deficiency. Strict vegans and sometimes vegetarians. Remember, the largest dietary sources of this vitamin is from animal products like meats, poultry, fish, and eggs, which vegans don't consume. Other people at risk are elderly adults, and this is due to poor absorption of nutrients in their GI tract. Also, people who regularly take antacids for heartburn or GERD will be deficient. Others at risk are people who consume a large amount of caffeine daily, chronic alcohol users, people consuming processed food or junk food regularly, smokers and potentially vapors, women taking oral contraceptives or birth control pills, people with eating disorders like anorexia nervosa. In fact, we treated this beautiful young girl in her early 20s suffering from severe peripheral neuropathy caused by anorexia. Also, there are certain medications that will deplete B12, like antacids for heartburn or GERD, such as PPIs like Nexium, Prilosec, or Prevacid, and H2 blockers such as Zantac, Pepcid, or Tagamet. Other medications that will deplete this vitamin are metformin, antibiotics, methotrexate used in chemotherapy, colchicine, which treats gout, anti-seizure medications, cholestyramine, a cholesterol-lowering drug, corticosteroids, and this includes taking it orally, systemically, like in an IV, as an inhalant, and even applying it topically. Okay, so this covers who's at risk. Now, let's address medical conditions that most certainly can cause a B12 deficiency. Here's the side note, guys. I can't begin to tell you how vitally important this is, because when we're treating a peripheral neuropathy patient, if we don't identify and address these issues, then chances are high, in fact, very high, that the peripheral neuropathy will return again. And then the patient has to start from ground zero all over again. And that's something no one ever wants. So, conditions that can cause a B12 depletion are things like celiac disease, a severe reaction to eating gluten-containing grains, gastritis, which is inflammation of the stomach lining, IBS or inflammatory bowel diseases like Crohn's or ulcerative colitis, short bowel syndrome. This is when portions of the small intestines have been surgically removed, pancreatic disease like pancreatitis, or pancreatic insufficiency, where the pancreas isn't producing enough enzymes to break down the food that you're eating. Bariatric surgeries are huge culprits for not only B12 deficiencies, but many, many vitamin and mineral deficiencies. H. pylori infections. This is a certain type of bacterial infection that can infect the stomach, and believe it or not, it's prevalent in about 2/3 of the world's population. This infection is the most common cause of ulcers. There are also a few genetic and autoimmune conditions that will result in this deficiency, such as pernicious anemia, a condition where there's a specific decrease in red blood cells because the body can't absorb enough B12. Also, transcobalamin 2 deficiency, which is a rare genetic disorder that impairs the transport of cobalamin, or vitamin B12, within the body. Another genetic disorder called SNPs, which will only be found on genetic testing, can result in a B12 deficiency. And this last one is the most commonly overlooked cause, and that's stress or high activity. For instance, if you're constantly busy and on the go with work or the kids or the household, maybe you don't get enough sleep because there just aren't enough hours in the day. Or you're someone who you might be training intensely for an event or a competition. The greater the stress load on your body, whether it's physical, mental, emotional, the greater the demand for vitamin B12, which can drastically drain your levels, especially when this is combined with a diet that's lacking in this very critical nutrient. So here are 10 of the most common symptoms that you should look for in a B12 deficiency. Unexplained fatigue, pins and needle sensation, numbness, tingling, or burning in the hands or feet, muscle cramps or muscle weakness, poor coordination, pale skin or when the skin and whites of eyes take on a yellowish color, frequent headaches, difficulty concentrating or a feeling of brain fog, pain and inflammation of the mouth and tongue. In severe cases, it can include vision disturbances due to damage to the optic nerve. And number 10, it can result in erectile dysfunction. Now, let's go to the exciting part. How do you make sure you're taking enough B12? Well, for non-vegans or non-vegetarians, it's easy. As long as you're eating red meat, organ meat, poultry, fish, dairy, eggs, you should be just fine. However, guys, this doesn't count if you're eating these food groups in the form of processed food or junk food. Processed food completely obliterate all of the essential nutrients that you need. And even if the food company adds back in essential vitamins and nutrients, I guarantee they're adding in synthetic and an inferior quality at that of these types of vitamins. Next, I want to talk to my vegan and vegetarian friends. Guys, I so applaud you for this lifestyle choice and for your respect and love for the farm animals that are really, truly being abused and mistreated. You guys are doing a great thing for your health and for the planet. So I just want to make sure that you're not inadvertently sacrificing your well-being. So here's what you need to do. Make sure you're consuming these important vegan food sources which contain B12. The first one is nutritional yeast. It's a great source of all of the B vitamins, but especially B12. I'm a strict vegetarian, and this is a crucial part of my diet. It really is yummy, and it has great flavor. And you can add it to rice, soups, eggs, really anything. But what's important is that you don't cook with it because you'll denature all of the B vitamins in there. So just sprinkle it on your food once your food is on your plate. Next on the list are shiitake mushrooms, another great source. I eat these 4 to 5 days a week, and they're also packed with other great benefits like protecting your cells from damage, boosting your immune system, and decreasing inflammation. Another great mushroom is lion's mane. Besides supplying you with great B12 levels, it improves brain function and concentration. In fact, research has revealed its promising benefits with Alzheimer's disease and dementia. These mushrooms also help with decreasing depression and anxiety. They boost the immune system function, and they've been known to decrease pain. Other vegetarian-based foods that will supply B12 are spinach, but make sure you're consuming this raw. Also, beetroot, butternut squash, tempeh, which is a fermented high-protein plant-based food made from soybeans. Also, spirulina, a blue-green algae, and nori seaweed, as well as chlorella, which is another form of algae. Be aware that these foods, though, will not have nearly as much B12 as the non-vegan counterparts like meat, eggs, etc. And if you're not consuming a large quantity of these vegan foods, you can still end up deficient. Now, get ready for another side note. Once you've developed significant symptoms from a B12 deficiency, simply eating these foods usually won't reverse the symptoms. And that's because when the deficiency gets severe enough, you need a larger than normal amount of daily B12 to replenish these stores that were within your body. So this means that you have to eat an astronomical amount of food. So At this point, you need to add in a B12 supplement along with increasing the foods that I just mentioned that are rich in B12. So this brings me to my last point. What B12 supplement should you never take? There are actually 4 different types of vitamin B12: cyanocobalamin, methylcobalamin, adenosylcobalamin, and hydroxycobalamin. The form you should never take is cyanocobalamin. I'll explain why in 1 minute. First, let's look at the other forms. Hydroxycobalamin is a highly bioavailable form of vitamin B12, but it's only available by prescription, and it's usually administered either in an IV drip or in an intramuscular injection. So this is used for people with severe or life-threatening deficiencies. This is not the form used when you go to your doctor's office and they give you a simple injection of vitamin B12. Both adenosylcobalamin and methylcobalamin are the naturally occurring forms found in foods. Adenosylcobalamin is mainly found in red meats, especially in organ meats like liver, while methylcobalamin is found in not only meat, but also fish, eggs, dairy, and vegetarian sources that I mentioned earlier. A good quality vitamin B12 supplement will be made from methylcobalamin. Since this is a natural form of cobalamin, it has the best absorption rate in the body and the best retention. This means it will stay in the body longer before being excreted out into the urine. Now, getting to the absolute worst form, cyanocobalamin. So what makes this form so bad? Well, first of all, it's synthetic and has a very poor absorption rate into the cells. Now, here's where it gets even dicier. Cyanocobalamin gets broken down into 2 molecules, cobalamin and cyanide. Yes, you heard me correctly, cyanide. Researchers have suggested that over time, there could be a buildup of cyanide within the tissues. Normally, in small doses, the liver would be able to clear this out of the body, no problem. However, in the 21st century, our livers are so overburdened with a tremendous load of toxic chemicals that many of them get stored back within the tissues of the body. So the buildup of cyanide can occur really with anyone, but smokers have an even greater risk of this buildup. Now, I want you to be aware that cyanocobalamin is the most common form used to fortify processed and packaged foods, including cereals. And it's frequently the form used when you get a regular B12 injection. So that's why when people ask me if a B12 injection is good for their health, my answer is, well, it depends, but probably not. If the injection is intramuscular and they're using hydroxycobalamin, great. But if they're using cyanocobalamin, you might as well skip it. Today, I'm going to talk about a certain B vitamin that is the most feared and misunderstood by both doctors and patients, and that's vitamin B6. I've had so many people reach out to me from Facebook and YouTube and tell me that they don't want to take B6 because their doctor told them that it damages peripheral nerves and they should stay away from it. Well, this is a very generalized statement used by a doctor that means well, but truly doesn't understand the nature of vitamin B6. So let's start by explaining why this vitamin is important to begin with. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that plays a key role in hundreds of chemical reactions in your body. For instance, it's significant to protein, fat, and carbohydrate metabolism. It's also necessary for the creation of red blood cells and neurotransmitters, especially serotonin and dopamine. B6 is indispensable for processes like brain development, maintaining peripheral nerve health, oxygen transport in your bloodstream, and healthy immune system function. Now, you may not have known this, but your body can't make B6 on its own. You have to get it either from your diet, that's if you're eating a healthy diet, because like the standard American, most diets will fall dreadfully short of fulfilling your requirements. Or if this happens, then you have to take a supplement containing B6. Like many of the other B vitamins, you can find a B6 supplement in 2 different forms. One form is called pyridoxine hydrochloride, or pyridoxine HCl for short. The other form is pyridoxal 5-phosphate, or P5P. Now, this is where the confusion sets in for the average doctor. Most doctors don't realize that there are two different forms. And even for the ones that do, they think they're the same and they're both dangerous. So let me enlighten you. The most frequently used form of vitamin B6 in supplements is pyridoxine HCl. This form is synthetic, meaning it's produced in a lab, not extracted from food, and it's used because it's very cheap and has a very long shelf life. Now, to be fair, although this form is artificial, it can be effective for some individual. But there's one small problem with using pyridoxine HCl. In order for it to become active and to be used by the cells, especially nerve cells, it has to be converted in the liver to pyridoxal 5-phosphate, or P5P, which requires a mineral called zinc. However, the World Health Organization estimates that 31% of children and adults are deficient in this precious mineral. And if that weren't bad enough, 40% of seniors are deficient. Now, these are conservative estimates, meaning the numbers are probably much higher for zinc deficiencies than what I've just indicated. So if you're lacking zinc, the conversion from pyridoxine HCl to P5P can't take place. This means the B6 supplement made from pyridoxine HCl that you just swallowed can't be used by your body, so it'll simply be eliminated through your urine. As problematic as this is, here's where it gets even dicier. When pyridoxine HCl B6 is taken either in high doses or used long-term, it can become toxic to peripheral nerves and cause damage. As a matter of fact, research has shown that if you take 100 milligrams daily for 2 years or longer, most likely you'll either cause or worsen peripheral nerve damage. This is why doctors are telling their patients to stay away from B6. And just when you thought it couldn't get any worse, pyridoxine HCl can actually interfere with certain medications for high blood pressure, rheumatoid arthritis, asthma, Parkinson's, anti-seizure meds, medications for COPD, and also with NSAIDs. Now, it's important to know that taking a B6 supplement is critical, especially for peripheral neuropathy sufferers. And this is because 20 to 25% of the population is deficient in vitamin B6, while 50% of seniors are deficient. Once upon a time, B6 deficiencies were almost unheard of because it's actually quite easy to get this vitamin in a healthy diet. But the reality is, so few Americans eat healthy. Because of this, it's become absolutely necessary to use a supplement to maintain sufficient B6 levels. I'll go into what causes B6 deficiencies a little later in this video. But for right now, don't despair, because the other form of B6, pyridoxal 5-phosphate, or P5P for short, is extremely safe, even when taken in high doses and long-term. So let's take a look at the advantages of taking this form. First, P5P is the active form of B6, meaning there's no conversion necessary by the liver, and it can be immediately absorbed by any cell in the body, including nerve cells. More importantly, it does not interfere with any medications. And as I stated before, it can be tolerated in extremely high doses. So the question you should be asking is, how large of a dose can someone take? Well, I'm so glad that you asked this question. Numerous research studies have proven that a person can take up to 7,000 milligrams daily without any neurological damage. That's 7,000 milligrams. Now, let me say this. No one needs to take anywhere near close to this amount. But what's amazing is that in all of the clinical studies done on P5P, not a single person experienced any side effects, even with these super large doses. Now, that's incredible. Well, let's talk about the benefits of taking P5P. We already mentioned that it's easily absorbed and used by nerve cells. Well, really any cell in the body, but in this case, it's extremely important for neuropathy sufferers. But there are even more advantages. For instance, clinical studies show that it diminishes neuropathic symptoms like burning, pins and needles or tingling sensations. It reduces inflammation. It maintains healthy nerve function. And it improves nerve conduction velocity, or the speed of the signals traveling down your nerves. This is important because if the transmission is slow, you'll get a lot of static or interference, which will result in horrible neuropathy symptoms. B6 also promotes brain health, and it reduces the risk of Alzheimer's. It reduces the risk of heart disease and clogged arteries as well, and it can make your immune system stronger. B6 can promote a better mood because it elevates your serotonin levels. In fact, some studies have shown that not having enough vitamin B6 in your diet can contribute to depression and anxiety. And lastly, it helps your body make more melatonin, which is important in helping regulate your internal sleep clock. Now, it's extremely as important for us to look at the causes of B6 deficiency, because you may go to a doctor that isn't very knowledgeable, who will tell you, this is the United States, and B6 deficiencies don't happen here because there's plenty of it found in food. Although this once was true about 50 years ago, it no longer is, and here's why. The National Institutes of Health revealed that these chronic illnesses can cause a B6 deficiency: kidney disease, rheumatoid arthritis, thyroid diseases like hypothyroidism, Hashimoto's, and Graves' disease, other autoimmune disorders like lupus and celiac disease. Gluten sensitivity can also lead to a B6 deficiency, as well as irritable bowel syndrome or inflammatory bowel disease like Crohn's or ulcerative colitis. Still, other illnesses that can lead to this deficiency are fatty liver disease, liver cirrhosis, cancer, ulcers, anorexia or bulimia, and systemic inflammation. Now, besides these illnesses, there are still many other things that can result in a B6 deficiency, such as medications like prednisone or methylprednisone, certain blood pressure medications like lisinopril, also neuropathy meds like gabapentin, Lyrica, Tegretol, and Topamax. Still, other meds that deplete B6 are diuretics, all anticonvulsants and anti-seizure medications, and oral contraceptives. There are also surgical procedures that will result in a B6 deficiency due to malnutrition or malabsorption issues, and those are bariatric surgeries for weight loss, small bowel resection, and lastly, a regular consumption of the following will also deplete vitamin B6 from the body: coffee or other caffeinated beverages. I know, don't start crying yet. Alcohol, soda, and processed foods containing white sugar and white flour. So you can clearly see how a person that's consuming the standard American diet made up of tons of processed food, caffeine, and alcohol can easily develop this deficiency. Now, if you want to make sure you're eating enough of this vitamin, you need to include these foods on a regular basis into your diet: fish, especially salmon, eggs, organ meats like liver, organic grass-fed and grass-finished beef, carrots, spinach, sweet potatoes, green peas, bananas, chickpeas, and avocados. Although dairy products and breakfast cereals are fortified with vitamin B6, I didn't include them in the list because the form used in these foods is pyridoxine HCl, which then gets destroyed during pasteurization and other processing methods. One last thing. If you suffer from peripheral neuropathy, you'll need to take a supplement in the form of pyridoxal 5-phosphate because you won't be able to eat the quantity of food necessary to replenish your stores of B6 or to repair your damaged nerves. Well, now you know you never have to be fearful of taking a B6 supplement ever again. Just remember, when looking for an overall vitamin B supplement or a nerve support formula or even a standalone B6 vitamin, always read the supplement facts panel, also known as the ingredient label. You only want to purchase supplements that contain B6 in the form of pyridoxal 5-phosphate. This is the safest form with the highest absorption rate. It will never cause harm to your nerves, and it won't interfere with any of your medications. Well, that's it for now, gang. Thanks for watching. If you enjoyed this information and want more like it, be sure to subscribe to our channel and don't forget to like us because it really helps us grow our channel. Also, please share this information with anyone you know who's suffering with peripheral neuropathy so they're not in this battle alone. Until next time, my friends, I look forward to seeing you on the road to great nerve health. Blessings. Tics can be found in 2 different forms. I've got my cue. Form is an active form that's safe for the nervous system, even when taking an extreme